Welcome to Module 2 of the course ICM Strengthens Midwives and Midwifery Globally. On each slide, there is an audio recording for you to listen to alongside the presented material. Each slide corresponds to documents found in the tile Documents on the home page. These documents are available for you to deepen your learning and understanding and may be useful in your everyday work. We've included one reflective activity, so do have a pen and paper to hand. There is also a mini quiz for you to do called Activity 1, and this is found on the home page of this presentation under its corresponding tile. The learning outcomes for this module are as follows. To understand the ICM's role as the global leaders for midwifery standards. To describe the ICM strategic direction. To identify the standards and positions held by the ICM. And finally, to learn the core work carried out by the ICM in relation to policy and practice, education, regulation, strengthening midwifery associations, advocacy and research. In the last module, we learnt that the ICM is the global voice for midwives and talked through an overview of the ICM's vision and mission, its structure and governance, and how the ICM operates. Here, building on that, it is important to understand that the ICM is the only global organisation that speaks for midwives and able to develop global programmes of work. For example, the ICM sets the global framework for midwifery, including the definition of a midwife, and has a set of resources to support the implementation of an evidence-based framework for midwifery care. Current ongoing work is continuing to strengthen and develop a new professional framework with stronger programmes to support the implementation. The ICM are the technical experts and work with midwifery associations to strengthen them, to advocate to governments as the voice of midwives and have the expertise to support national developments in maternal and newborn health services. In this module, we're going to deepen our understanding of the scope of ICM's work. A key area for the ICM relates to strategic planning, in which the current strategy of 2017 to 2020 has focused on quality, equity and leadership, which is found in Document 1. This is due to be updated mid-2020 at the Triennial Council meeting in June in Bali. A key component of the ICM's work to strengthen the midwifery profession relates to the work on policy and practice. This includes 47 position statements on a wide range of topics, ICM definitions, global standards, essential competencies for midwifery practice, a glossary of terms, the Bill of Rights for Women and Midwives, the International Code of Ethics for Midwives, as well as the philosophy and model of midwifery care. All of these documents are found here for ease of access, but be sure to check the website as these are regularly updated. A key document of the ICM is the Bill of Rights for Women and Midwives. Primarily, the ICM raises that the issues for women around gender equity and access to education also extend to midwives as a woman-dominated profession. The Bill of Rights for Women and Midwives addresses those basic human rights of women and midwives that have been systematically denied and adds another framework to approach governments when demanding change to improve midwifery and maternity services. See Document 5 for the full version, and we will cover human rights related to childbirth in Course 2 in more detail. But the important emphasis here is that the midwifery profession faces the same gender discrimination that women in our care face, something that ICM is working hard to address. Another core document of the ICM is the International Code of Ethics for Midwives. As the ICM is committed to improving the standard of care provided to women and families, this code guides education, practice and research of the midwife. The code acknowledges women as persons with human rights, seeks justice for all people and equity in access to healthcare. Moreover, the code is based on mutual relationships of respect, trust and the dignity of all members of society. The full document can be found under Document 8 and on the ICM website, but this diagram provides an overview of the 4 key areas the code covers: midwifery relationships, the practice of midwifery, the professional responsibilities of the midwife, and the advancement of midwifery knowledge and practice. Here on this slide you can read the ICM definition of a midwife. The ICM sets the international standard that has global recognition. For safe and effective midwifery care, it is vital that we use these standards to ensure women have access to the best available evidence-based care. We will discuss this at much greater length in Course 2, but for now, take the time to read the statement, which is also found as Document 10 and on the ICM website. The ICM also clearly sets out a philosophy and model of midwifery care. The philosophy recognises that pregnancy and childbearing are usually normal physiological processes, and it is a profound experience that carries significant meaning to the woman, her family, and the community. In addition, midwives are the most appropriate care providers to attend childbearing women, and midwifery care promotes, protects, and supports women's human, reproductive, and sexual rights, and as well as respects ethnic and cultural diversity. It is based on the ethical principles of justice, equity, and respect for human dignity. Midwifery care is holistic and continuous in nature, grounded in an understanding of the social, emotional, cultural, spiritual, psychological, and physical experiences of women. This takes place in partnership with women, recognising the right to self-determination, and is respectful, personalised, continuous, and non-authoritarian. The ICM model of midwifery care advocates that midwives promote and protect women's and newborns' health and rights. Midwives respect and have confidence in women and in their capabilities in childbirth. Midwives promote and advocate for non-intervention in normal childbirth. Midwives provide women with appropriate information and advice in a way that promotes participation and enhances informed decision-making. Midwives empower women to assume responsibility for their health and for the health of their families. Midwives practice in collaboration and consultation with other health professionals to serve the needs of the women, her newborn, family, and community. Midwives maintain their competence and ensure their practice is evidence-based. Midwives use technology appropriately and effective referral in a timely manner when problems arise. Midwives are individually and collectively responsible for the development of midwifery care, educating the new generation of midwives and colleagues in the concept of lifelong learning. Another key component of the ICM's work is that of education and the development of global standards for education, curriculum, and essential competencies. Many of these documents are currently under review with view to being updated. However, the essential competencies was recently updated in 2019 and can be found as Document 5. Regulation is a vital component of the ICM's work, so that women and families are protected by ensuring that safe and competent midwives provide high standards of care to every woman and baby. By raising the status of midwives through regulation, the standard of maternity care and the health of mothers and babies will be improved. Regulatory mechanisms, whether through legislation, employment or another, is achieved through 6 main functions shown here. Setting the scope of practice, pre-registration education, registration, re-licensing and continuing competence, complaints and discipline, and codes of conduct and ethics. The purpose of the regulatory standards is to describe the framework necessary for effective midwifery regulation. The framework defines the elements of regulation in order to determine who may use the title of midwife, describe the scope of practice of a midwife consistent with the ICM definition of a midwife, ensure that midwives enter the register following education consistent with the ICM global standards for midwifery education, ensure that midwives enter the register able to demonstrate the ICM essential competencies, ensure that midwives are able to practice autonomously within their prescribed scope of practice, ensure that midwives demonstrate continuing competence to practice, ensure that midwives and women, as users of midwifery services, are part of the governance of midwifery regulatory bodies, and ensure public safety through the provision of a competent and autonomous midwifery workforce. In addition, the ICM has a regulation toolkit to provide support in this area, and it is found here as Document 11 or on their website. A core component of the ICM's work is with midwifery associations. A midwifery association is a formal association of midwives, usually non-profit, seeking to further the profession of midwifery, to promote the interests of midwives, promote midwifery standards and the role of the midwife, including enhancing the health and welcoming of childbearing women, their newborns and their families. The ICM strongly advocates that in strengthening midwives associations internationally, together they will advance the profession of midwifery globally by promoting autonomous midwives as the most appropriate caregivers for childbearing women and in keeping birth normal. This enhances the reproductive health of women, their newborns and their families, which we discuss at length in Course 2. As you can see, this interactive map that is found on the ICM website show the pins of all the current member associations. If you go onto the website, you can explore the map, which also provides country-specific statistical data, such as the number of midwives, maternal and neonatal mortality rate, crude birth rates and breastfeeding rates, etc. Why not click on the link below and have an explore of the interactive map? The ICM works to develop the leadership and advocacy capacities of midwifery associations. The associations will enhance the ability of midwives worldwide to achieve the global objective of improving the health of women and families. The ICM provides both guidelines and a capacity assessment tool for associations, and this diagram shows the processes required of new midwifery associations.
Welcome to the Midwifery Services Framework, the road to a better future for every country. We all want to keep women and their newborns safe, before, during and after pregnancy and birth. One of the best ways to do this is through midwife-led care. This journey starts and ends with healthy women, newborns and their families. MSF brings together Ministries of Health and Education, midwives and others to work on the changes needed to implement midwife-led care. Our first step is to identify existing gaps and agree on the priorities for the package of care that women need. Next, we organise the health system to support midwife-led care so that women and their newborns receive good quality services which are accessible, acceptable and available to all. Now we build a professional midwifery workforce by ensuring sufficient, well-supported and regulated midwives, recruited and deployed across the country, whose skills are developed through competency-based education. Then we create an enabling environment where midwives are recognised, resourced and valued, and can practice autonomously within an integrated midwifery service, with access to backup and emergency services, and where women and newborns receive respectful and safe care. Finally, we meet to monitor, evaluate, adapt, and continue to strengthen the Midwives Association, ensuring our midwifery services framework is successfully integrated with the country's health system. We hope you will join us on the MSF journey, because all women and newborns have a right to quality midwifery care, whoever they are, wherever they live.
Bringing together and integrating the work of the ICM we have discussed so far is this video that focuses on an international maternity services framework. This video shows just how developing a quality midwifery workforce in countries protects the lives and health of millions of women and children. The ICM strongly and vocally advocates for high-level political commitment in all countries to provide more investments in midwifery education, deployment and retention to address the problem of the shortage in midwives. Take some time to watch the video now. The ICM is committed to leading the way in advocacy efforts to raise demand for midwives and to advocate for equitable access to midwife-led services for women. This is because we know that midwives are the key to improving health outcomes for women and their newborns during childbirth. The picture here is one of the many examples of advocacy kits found on the ICM website, and it is also found as document 14. But be sure to check the ICM website regularly, as the advocacy toolkits are frequently updated and new resources are created. A contribution to global research is also a core component of the ICM's work. Research is the foundation of ongoing education and advancement, and research is the lifeblood of any vibrant profession. These pictures provide a snapshot of some of the influential work the ICM has been involved in and continues to be involved with. Some of these we've discussed so far in Course 1, and others, such as the Lancet Midwifery series, will be examined in Course 2. In addition, the ICM has a Research Standing Committee who provides the midwives associations with up-to-date information on all aspects of midwifery practice, education and service. The committee plays a key role in the development of the ICM's triennial congresses. The Research Standing Committee has a number of roles. For example, it identifies midwifery research in progress and takes part in the discussions to develop the ICM research strategy. It creates communication networks between researchers working in reproductive health and midwifery, as well as maintaining a database of researchers which acts as a source of information and support. The committee also makes recommendations to the ICM Board, Executive Committee and Council. The committee also reviews abstracts submitted for peer review and provides a resource of expert midwifery research workers for access by ICM if required. We have come to the end of this module and course. In this module, we have covered the ICM standards, positions and tools, where we have identified that the ICM is the global leader for midwifery standards. We have explored the core work of the ICM that relates to policy and practice, education, regulation, strengthening midwifery associations, advocacy and research. We have provided you with a number of resources as part of this module, but we do urge you to explore the ICM website too. Our work continues to evolve and grow, with new updates released on the website frequently. We do hope you have enjoyed this module.